My name is Kulkarni. I'm one of the interventional physiatrists here at Orthopedics Northeast. I'm in the pain division at Ortho Northeast, so basically a lot of the stuff we take care of is, as you can see this, it is the spine. So today I'm going to talk to you guys about what options patients have if they have disc herniations in their lower back. Most people think you have to look at surgery or epidural injections or take pain medicines, but there is another unique procedure that we do as interventional pain doctors, is that if you see this point right here, this kind of shows you the bony anatomy. This is your lumbar vertebrae. This is your intervertebral disc here. And this red spot kind of shows where that disc is kind of buckling out and herniated, and also can get close to your nerve root. It can irritate and cause pain. So most times patients will undergo epidural shots in this area. Other patients may have to have surgery if the disc is really big. But there's another option for patients who have back pain, leg pain, if they have a small herniated disc, and that is what we call is a lumbar percutaneous discectomy. The procedure is done with you actually laying on your stomach. So we just, as a procedure goes, we numb the area. This basically is just an introducer. So once the area is numbed up, the physician can insert that probe or that introducer on the side where your disc is herniated. And then once that needle gets into the center of that disc, we take out the stylet in the middle, and then we can actually introduce this device, which is what they call a decompressor probe. Once that probe gets inside the disc in the middle, we just turn the device on. It spins around for about 2 minutes, and we're able to then remove it and collect the disc tissue. As you can see in here, there's a reservoir in here, so that disc material collects in through here and dumps in here. And we can then, at the procedure's done, remove that part off. And I take this little black piece of plastic, and I can just slide this through and remove whatever disc material that we collect. That allows us to send it to the pathologist for review. And then we can also see how much material we actually took out. So sometimes we can go back in there and take more tissue out if we think it's necessary. But if on the first try, if we get a good amount of tissue, we just leave it alone. Usually the procedure like this can take about 15 minutes to do. So opposed to like a big surgery, there's no surgical scars. You just have to numb it up, just poke the skin and do the procedure. The recovery is really quick. You can do pretty much most of your normal activity the following day. The only thing I tell patients is don't do any really heavy lifting for the first month, because your disc is an interesting structure. It's like a big basket weave of fibers. So I want that area to heal a little bit before we put too much pressure through there. So most people, if you don't have any heavy labor jobs, you can go back to work right away. If you do heavy labor work, you probably have to take it easy, limit your weightlifting to no more than 15 pounds for the first month. When we do your reevaluation about a month later, if you're doing really good, we can let you go back doing your normal activity. The key thing about this procedure, since we're not cutting you open, that it does take a little bit of time for that disc to shrink, because we're not just removing the disc off completely or shaving that part off. So over time, like the first month, 3 months, and 6 months, this disc will continue to shrink. So some people get better and better and better even 6 months out from the date of procedure, and hopefully they can return to work and do their activities without much restriction. So that is the procedure I'm talking about today. So if you have any questions, call Ortho Northeast.